Hello, everyone. Just want to talk about my work and what do I do in my daily routine when I go to work. So, as some of you already know, I'm a health assistant nurse, and just here to explain what is a health assistant nurse because people ask me all the time about it and what is the job intake. So, what I do mostly is help the nurses. That's the basic idea of the job. I help the nurses, and with my where I work, it's a subacute, so it's mostly rehab. So it's helping all the allied health and the health staff, and including if I get to talk to the doctors about certain issues, or nurses, or even my manager, my unit manager, or even all the OTs, physios, anyone that has to do with the allied health field as well. So my daily routine is normally including showering patients, washing them in bed, changing their pads, um, and all sorts of jobs that I have to help the nurses with. So there's a lot of work into it. It's not for everyone, but some people, if you enjoy this kind of helping patients and that kind of work, it's a very giving kind of job. And mostly in what I see, it's in subacute, is in rehab. We have people here in Victoria, because I'm in Victoria, that do this kind of jobs. Very similar to like a PCA. Who doesn't know, PCA is in aged care. They do helping the client or the person in aged care with the daily routines. So it's similar kind of work. So with my work, I don't give any medicine at work, but I do most of what the nurses do. Mostly is starting my day is getting my handover from my manager, and then starting my job by going to each room and asking the nurses for that room what they need with the patients, and mostly is who needs showering for the day, and then going on. So I in my ward I have 30 patients, so I try to help as many people as I can on that ward. So I will go to each bay and ask each nurse on that bay what they need, and then from there I look at which room needs changing of sheets. So every day we do different sheets. A different room has needs changing their sheets, and as well other patient needs changing of their sheets because they're dirty. But that's what our routine is in work as well. I Yeah, after showering people and changing people, sometimes you have to hoist patients to the wheelchair or to wherever they need to go, and as well turn patients if they need changing. You get to help the nurses in all sorts of situations. There's a lot of work and there's a lot of things I need to do in my work. Um, and it's hard to explain in one sentence as what I need to do, but there's a lot of big routines I need to do. As well, there's people that are going home or they're going to aged care that day. I need to help with packing them up, getting them ready. If it's showering, changing, putting their clothes on, anything that needs to be done on that day. And if anyone coming in, because someone's leaving, someone's coming in, I need to check what they brought with them and document what they bring with them and anything like that. So just to explain, is a lot of work when it comes to nursing and assistant. How I got here, I studied. So for me, my past, I was a patient service assistant. I was mostly like an orderly or cleaning people's, cleaning hospitals, cleaning the wards, stuff like that. That was my initial job. I got into nursing, doing enroll nurse course, Unfortunately, my school closed down. I did over a year of study, but they had to close down. So I quit my studies and I found a job as an assistant in nursing through that way. But there's other ways in getting into that field. So a lot of people do a course called Certificate 3 in Assistant Nursing, here in Victoria at least. Or you can do a PCA Certificate 3 or Certificate 4. Now there's a difference when it comes to Certificate 3 and PCA or Certificate 4 and PCA in terms of assisting in nursing in hospital. It's the different grades. So most people that work in healthcare have different grades, and higher grade you're in, the more you study, the more you earn. So at the moment I'm in grade 3, so you can go from grade 1, 2, or 3 when it comes to assistant in nursing in Victoria, and I'm on grade 3. So whoever is liking this kind of information, I'm happy to give you more information. I know that every state has it differently and they do it a bit differently. I'm happy to listen to hear if anyone have anything to say about this, and I'm happy to give any answers if anyone have anything. So if you're not subscribed, please subscribe, comment if you want to, and I'll see you next time. Thank you. Bye.